Hi, I am Dr. John Davis Akkara, Associate Consultant Ophthalmologist, Glaucoma Specialist, and Senior Resident in Sri Ramchandra Institute of Higher Education and Research. I am here to talk to you about the types of glaucoma and its risk factors. The types of glaucoma include open angle glaucoma, angle closure glaucoma, normal tension glaucoma, glaucoma in children, pigmentary glaucoma. These are the main types. There are multiple other types which are rarer. So, open angle glaucoma is the most common form of the disease. The drainage angle formed by the cornea and the iris remains open, but the trabecular meshwork is partially blocked. This causes the pressure inside the eye to gradually increase. This damages the optic nerve. It happens so slowly that you may lose vision before you are even aware of a problem. And this is why glaucoma is called the silent thief of sight. Another type of glaucoma is the angle closure glaucoma, also called the closed angle glaucoma. It occurs when the iris bulges forward to narrow or block the drainage angle formed by the cornea and the iris. As a result, the fluid inside the eye cannot circulate through the trabecular meshwork and the pressure increases. Some people have narrow drainage angle, putting them at an increased risk for angle closure glaucoma. Angle closure glaucoma can present as an angle closure attack when this block suddenly increases the pressure, and it can present with severe pain, watering, redness, and even pain severe enough to cause vomiting. So that is called acute angle closure attack. That is a medical emergency. To treat that, you will have to immediately come to an ophthalmologist. They will reduce your eye pressure and ultimately do a laser procedure on your eye. Another type of glaucoma is called the normal tension glaucoma or the normal pressure glaucoma. In normal tension glaucoma, your optic nerve becomes damaged even though the eye pressure is within the normal range. As a reference, the normal eye pressure is considered to be between 10 to 21 millimeters of mercury. This is measured by your ophthalmologist using various devices such as a non-contact tonometer or an applanation tonometer. So in normal tension glaucoma, even though the pressure is normal, the optic nerve is damaged. The exact reason for this is still under research, but the optic nerve damage is the reason to start treatment. So this there could be limited blood flow to the optic nerve, or there could be a mismatch between the pressure in the optic nerve inside the eye and the pressure behind the optic nerve from the cerebrospinal fluid. So it could also be due to several other conditions such as atherosclerosis and fatty deposits in the arteries. So if normal tension glaucoma has to be investigated further. Glaucoma can also occur in children and infants, and this may be present from birth or may develop in the first few years of life. The optic nerve damage caused by this can permanently cause a poor visual outcome in the children. So it is very important that children suspected to have glaucoma are brought to the attention of an ophthalmologist as early as possible. Children usually, if they have glaucoma since birth, they would have a hazy cornea, that is the hazy part of the clear part of the eye. They would have watering, they would have, while growing up, their eyes might become much bigger. So these are all reasons you have to consult an ophthalmologist early. Another type of glaucoma is pigmentary glaucoma, in which pigment granules from your iris, they they spread and build up in the drainage channels, the trabecular meshwork of the eye, slowly blocking the fluid exiting your eye. Sometimes activities such as exercise and jogging can release these pigments and deposit them on the trabecular meshwork more, and can cause intermittent increase in the pressures. Now, coming to the risk factors for glaucoma, uh, it is very important to know this because chronic forms of glaucoma can destroy the optic nerve and the peripheral vision before any further signs or symptoms are apparent, and you may miss it until it is too late. So it is very important to screen people who are at high risk for glaucoma. So these risk factors include having high intraocular pressure. So having high intraocular pressure can be checked very easily by going to an ophthalmologist and checking on a non-contact tonometer or an applanation tonometer. Another thing is age. So above the age of 60, there is a high risk, and we would recommend that you get screened for glaucoma above the age of 40 so that you can be safe. And if there is any chance of developing glaucoma, you can find it early and prevent or treat it. Another reason is the ethnicity. So African, Asian, and Hispanic ethnicities are at a higher risk for glaucoma. Another reason is a family history of glaucoma. So if anybody in your family, especially close relatives, are having glaucoma, it is a high risk factor of you also having glaucoma. So it is very important that the family members of those who have found to have glaucoma are screened for glaucoma. Another thing is having some medical conditions such as diabetes, heart disease, high blood pressure, and sickle cell anemia. So those people who are having certain comorbidities such as this, please do get screened for glaucoma. Having corneas that are thin in the center is also a risk factor. This is also measured by the ophthalmologist using a pachymeter. Another reason could be being extremely nearsighted or far-sighted, so that if your glass power is very high, if it is very high in the minus range or very high in the plus range, those are both risk factors for glaucoma. Having an eye injury or some types of eye surgeries is another risk factor. So if you have had an injury, very commonly people come with a ball hitting the eye and they feel better soon and they just ignore it. And later, after a few months or years, they are found to have glaucoma. So it is very important if you have a eye injury to get screened for glaucoma at an ophthalmologist. Some types of eye surgeries can also increase the risk for glaucoma. So your doctor would tell you to check your eye pressures and get reviewed with a few months. So please follow the review advice as told to you. Some medications, such as corticosteroids, especially steroid eye drops used for some treatments, can also increase the eye pressure and cause glaucoma. So, if you are using any eye drops, please make sure that you do it under the recommendation of a doctor. And if you are advised to stop the medication after some time, please do stop it. Don't continue the medication for a long time. So, these are some of the risk factors for glaucoma. I hope this was useful information. Thank you, everybody.